Hello, everybody. Welcome to the Mindful Momentum podcast. I am your host, Robin Todd, and I'm so excited about today's guest. We have a double whammy today because we are fortunate to have two guests with us who I recently met through a mutual friend who are truly rock stars in the space of mental health in the construction industry. And I'm excited to learn more from them today. And I know that you will appreciate their wisdom and insight as well. So let me introduce you to those two people. First, we have John Burcaw Institute. With more than 2 decades of experience developing organizational programs and strategic initiatives across the U.S. and Canada, John has a proven ability to build institutional cultures that elevate student growth and industry outcomes. Though now a senior leader, John is still a painter at heart, someone who loves rolling up his sleeves, getting his hands dirty, and staying connected with his students. He and his wife, Margaret, have been married 32 years, awesome, and have 3 grown children, 1 grandchild, and another on the way. Woo woo! That's awesome. So welcome, John. Thank you so much for being here. Joining him is Jennifer Stanek. Jennifer, did I pronounce that correctly?
Correct.
Okay, good. I meant to ask that before we started, but here we are. Jennifer is the Chief Executive Officer and Medical Director of Team. Is it just Team, or is there more to it than that?
We're Team Wellness Corporation.
Wellness Corporation. Okay. Jennifer spent over 20 years practicing as a physician assistant across multiple medical specialties before transitioning into her current executive role. Her career has been driven by a deep passion for reducing barriers to both medical and mental health care. She believes strongly that when people can access high quality providers, excellent and patient care naturally follows. Outside of work, Jennifer finds joy and restoration in the great outdoors, especially the underwater. So, which is a little scary for me. So I would love to visit with you more about that. I'm guessing are you like a scuba diver?
Yes, ma'am.
Okay. Where's the best place that you've ever scuba dived?
For those who know me, they'll know this answer. It depends. There is beauty in every place I have been. One of my favorite dives was in Moorea. We did some lemon shark diving, and it was just lights out amazing.
Wow. Okay. That's so impressive. It does kind of scare me when thinking about being way underwater. Anyway, okay, we digress. So together we're going to just learn as much as we can from Jennifer and John today. So let's go ahead and get started. And John, why don't we start with you? What originally sparked your passion for addressing and improving well-being, that culture in the construction industry, and how has that purpose evolved as you've continued to be in this space? Tell us a little bit about that.
Thank you, Rob. That's a great question and maybe a bit of a long answer, but a lot of it ties back to my own lived experiences. As a young man, I was caught up in the throes of addiction, homelessness, criminality, which ultimately led me to being incarcerated as a young person. And upon my return from incarceration is where I really started to see opportunities for folks like myself in the trades, even though I hadn't realized it immediately at the time. I started my career as a painter in 1991. Against my better judgment, I was encouraged by my father to find gainful employment. He had some fellas come over and do some work at his house. Like a good dad, he said, "Hey, can you get my kid a job?" And they said, "Sure, go down to the apprenticeship school. They're always looking for young folks interested in getting in the trades." And I kind of held my head and went, "Oh, is this really what I want to do? What have I get myself into?" So I did what my father asked of me, and I went down and I signed up to be an apprentice painter in Omaha, where I'm from. And I was supposed to go to work the next day. However, I wasn't that excited about the work I was about to undertake. I went home and I spoke to my father. I said, "You know what, Dad? I did everything you asked of me. However, they don't have any jobs." And he says, "Well, what's going to happen?" He says, "Well," I said, "they'll call." And I thought I dodged a bullet and I prevented my entry into the world of painting and decoration. I thought my father would just forget. We had the conversation eventually. And lo and behold, for those of us old enough to remember, I got the recording on the old tape answering machine and said,
Oh
"Hey,
yeah. Oh yeah.
why hasn't John been to work all week?" My father was a little upset, drove me to Serving Roebucks that night, bought some boots and some pants, and he drove me to work
Ah, I
the
love it.
following, the
Like a
following
good
day.
parent, right?
And I wasn't sure what I'd gotten myself into, but I realized right away the value of the mentorship I received, even on that very first day, working with experienced trades folks who've been around for a while, and their investment in me almost right away. And in my mind, I was just a chucklehead kid that had made a whole lot of mistakes, maybe not worthy of the investment. And that was almost 35 years ago now. And it's been a great journey ever since. And but I was a little bit ashamed of my past. I didn't advertise the fact that I was in recovery. I never advertised the fact that I had been previously incarcerated or unsheltered because I didn't want it weaponized or used against me as I went through my journey as an adult. And so I kept it to myself for quite some time. And I think a lot of folks have done the exact same thing, this unwillingness to share lived experiences. And it wasn't until later when I went back to college that I had a professor encourage me to tell my story. And it kind of empowered me to do so, um, understanding that I could help other folks if I was willing to do so. And I decided that I would start to give little peeks into my past, little glimmers. And now I have no reservations about sharing my lived experiences. Because now knowing so, that's how we can help other folks find their way. And it really goes a long ways to just normalizing and destigmatizing these really tough conversations
Yeah.
that really don't have to be that tough.
Yeah. Well, thank you for having the courage to and for the person who challenged you to step outside your box and do that, because I think you're exactly right. Um, it's amazing to me always once you start opening up, other people feel encouraged, and that courage to actually kind of then share their story, and then we get to connect and we get to see that we're all a work in progress and we've all got our stuff. Yeah. And I love also your story of just hope that even after all of that, you can still have a life and find joy and find purpose in that struggle. Because look at what wisdom that has given you, that you have that to share with the students you teach.
It's really remarkable. I mentioned this to a colleague recently that I never thought my shenanigans as a young man would actually benefit me someday. And I wouldn't have it any other way. It
Yeah.
made me who I am, the person I am today, and it gave me that ability to help others at
Yeah.
the same time. So,
That's
once
awesome.
upon a time, I was pretty uncertain of what I had done, and today I really embrace
Yeah.
that journey who's made it who I am today.
Yeah, that's awesome. All right, Jennifer, how about you? Where does your passion lie? Where did it start?
Yeah, I have just always noticed through my career in medicine, you come out of school with this shiny white coat on and all these plans on how you're going to help people. And I think those of us that really love to care for people just see a deficiency in how people can actually get care or receive care, or those populations that get lost. And in my family, we have a lot of tradespeople, and I would see all the time people not have access to care. They're working too late. They didn't have access to daycare or access to the things they need, and you just go. It's not uncommon in this industry for people to be required to work 6 or 7 12s. You make hay while the sun shines, and you just do it, and you're away from your family and away from your home and away from good food and away from medical care and all the things you need. And it takes a big toll. And I always wanted to be able to provide that or find a way to provide that for people in need, of those services. I was always that person in my house that everybody called every time they needed something. And like John said, when you start to normalize the conversation, it's amazing what can happen when you start to be able to remove those barriers or people can't access, and now all of a sudden it's accessible or affordable. it just opens the door for people to get good care. And John and I were just talking about a story when he was with a group of students, just being able to normalize a conversation about a lived experience, to be able to talk about it. And we look at the evolution of peer support in the trades and what a difference that's going to make. But to have a group of people all of a sudden realize that it's okay to talk about it, people who they work with, people that they see on a daily basis, to not have to worry about being shameful about needing to get help with something, or to not have pressure to go out and do something, or even just to be able to say, I need help finding groceries. Like, I can't afford to pay my electric bill. And who do I go to? So it's been a really amazing to see how the change in the culture that John has brought to the table, what it does to the apprentices, and the program itself. It's pretty amazing.
Yeah. Well, and what I think is interesting too is that it's just funny how life works, is that you saw this through your family, and then you were offered an opportunity to actually not just sit back and observe that, but to actually change the status quo. Is
Yeah.
that correct? And kind of at team?
Absolutely. Yeah. And I think I still remember stepping into this role. I had colleagues that would ask, like, are you worried about taking your white coat off and not walking into clinic every day? You're not going to touch any lives. And I look back and say, I might not touch 35 lives a day, but we touch thousands of lives a day. To
Yeah.
be able to create a culture of professionals that want to help people with the same passion that I developed through my years of medical practice, and to be able to give that to everybody in the community that we serve, it's an incredible privilege. And I touch many more lives now than I ever could have imagined when I first started to practice.
Isn't that awesome? That's wonderful. Yeah, awesome. Well, thank you so much. So let's talk a little bit about, we know construction's this fast-paced, high-stress environment, as you already alluded to, oftentimes difficult situations, challenging, and these expectations that just aren't physically and mentally and emotionally places where we can thrive, right? So, from your perspective, what do you think the biggest cultural shifts that need to happen in order to truly support mental health on the job sites?
That's a big question.
I know it is a big question. Sorry. But I mean, even just like, you know, wouldn't it be cool if, like, what is it that's gonna, and I know that's the $1 million question, but I'm sure you have some thoughts on, what do we need to do differently?
I I really believe that, as we look at employees, to not treat them like a commodity out there. I mean, there's been so much pressure and change in the construction industry, and I think John could agree with this as well. When we look at the requirements, when jobs are being bid and the time frames are being shortened, there's so much more pressure to be on the job, longer hours, longer days. But there's also this push pull. I mean, there's a lot of people that they want the overtime. They want to be able to work. They don't want to be cut from jobs. And so I think there's going to be a big challenge ahead to look to see how that can impact the industry. I know there's a lot of communication about that right now, how we can look at the effects of the long hours, the mandatory seven day work weeks, and how that affects mental health. I even liken it to the way we used to be trained back in medicine. It was not uncommon for us to cover a 14-hour day, round at a hospital, get a couple of hours of sleep, and get back to it the next day, and expect to work at your optimum performance because
Right.
somebody's life was at stake. And I think in the construction industry, it's something similar. You're expected to work long hours, get little sleep, be away from home, stay in a hotel room, and still be that person that builds the crane the next day that your colleague is going to get up in, to hopefully safely perform their job. And when people are fatigued and not well nourished, it's really hard to be on your game. And these are all very safety sensitive positions. At the same time, you
Absolutely.
don't want to pull back and not give people the opportunity to work. So I wish there was a golden answer to that, but
Yeah.
there's a lot of conversations that I participate in that where I have organizations that come to me to say, hey, we're looking at this policy or how we're going to change this. How do these hours, do you think they're going to affect our people? More than just being tired. We
Yeah.
also see substance use disorder go up a lot. It's not uncommon for people to use substances to be able to stay awake for that 14-hour shift, and then have to use a substance to go to sleep so they can sleep hard enough for 3 or 4 hours to get back up the next day and do it again. And so we see so much co-occurring disorder as it pertains to that chronic fatigue. Again, the stress affiliated with being away from home, the nutrition aspect of things, and then substance use disorder rising because of that.
Yeah. Well, and I'm excited. I think we're going to talk in a little bit about some analytic and statistics, but I do think that's going to be exciting as we're getting more of those statistics because I think you're right. And it's common sense that you can't be operating in that mode. You can't sustain that kind of rigor and not have that compromise those safety protocols. And so a lot of people we talk to, in the work that we do is really coming through that safety door because it is many industries in the construction industry are extremely dangerous. You don't really think about it until you do. And then it is quite amazing. And I don't want, just like I don't want the doctor on their 14th hour operating on me or advising me. And I don't want the construction worker on their 14th hour or whatever, right? Um, Building my home or building the elevator system that, is eventually going to break from a mistake, So yeah, I love that insight. And I think the analytics will be interesting as they come out. Yeah, John, did you have any thoughts on that you
Well, I
wanted to
think for
add?
me, I think for me is I would love to see mental health and physical health no longer separated. And we could just talk about the healthcare that folks need.
Yeah.
And I often talk to our students about if a friend, neighbor, or colleague had a cancer diagnosis, we would be quick to do a GoFundMe. We would bring groceries, we would cook food, we would help watch kids, we would help run errands. But if somebody, for the same reasons, were to check themselves in to receive mental health care or support for substance use, you don't get the same response. You're not going to see people lining up to support them. It's gonna oftentimes we see just the opposite. People pull away, get real quiet, get uncertain. When really it's simply healthcare. This is healthcare, and this is the healthcare that folks need.
Right.
And I also hope to someday that we could just be better to one another. Just be a little bit kinder, a little bit more understanding, a little more empathetic, show some compassion. We're all trying to get through this thing together, and we don't need these tough guy and tough gal facades in order to do that. We need each other in order to get through these challenges that we face. And so my hope, and I like to talk to our students all the time, is like it's so much easier to be kind, decent, and honest than otherwise. And we appreciate it because we never know who's going through what. And so just assume we're all going through it and just be good to one another.
Yeah, yeah, I love that. Well, and you are in an interesting position in that you're really training our future workers, right? And I love that because eventually they're going to be the old timers. So it's going to take some time. We certainly don't want to leave those old timers out. But I think it's a beautiful approach and a really important approach of really instituting those mindsets, through that apprenticeship program, the things that you're developing. And I agree, and I would love to. I probably should do a little more research on this, but it's interesting to think about where that separation of, mental and physical actually occurred. And maybe it's because we call it mental instead of brain. It's like heart, lung, brain health. And that's where our thoughts reside, but it's no different than an organ, an important organ in our body. And I love that. Just even changing that verbiage can help shift those perspectives and mindsets. Yeah. Awesome. Okay, so let's talk a little bit about you both are, as I mentioned, at our onset rock stars in this space because of the innovation that you've brought and really stepping outside of what's normally been happening in both of the things that you do. I would love for you to share with our listeners and viewers some specific initiative programs or programs, initiatives, practices, things that you've implemented that you felt has made a real meaningful difference. And I know there's many. So, in lieu of time, just, maybe your top, one or two or most recent that you just think are, yeah, worth sharing.
Well, I think to kind of frame the highlights we'd like to make, I think it's important to note that we made a conscious decision to bring licensed behavioral health clinicians and care coordination and nutrition support. We made a conscious decision to bring these resources on campus through our school in partnership with Jen and her team, to make access as easy as possible. So to put this resource in our school, we feel like we may be one of the first in the nation around registered apprenticeship that has taken this step to put clinical staff inside the school to be there for our students. And we feel like we didn't have a choice. We feel like this was a necessary next step, knowing that the trends, particularly around suicide in construction, um, are not trending in the right direction, and they continue to be the number one cause of death faced from those that work in the construction industry. So we felt like it was not an option, it was a necessity. And the focus was on drop in counseling, scheduled counseling, crisis intervention, education, outreach, and advocacy is our strategy. And while counseling and crisis intervention are probably well-known strategies for those listening today, we're really excited about two things that we believe are innovative and have really gotten a lot of results. And early on in our conversation, we talked about and alluded to like the disposable human capital. Well, three strikes and you're out. If you're late too many times, we'll get rid of you. You no call, no show for school. We're going to separate you from the school. And we really don't want to be a part of that. Our learners are adults. Adulting can be challenging at times. So there shouldn't be a penalty for you when life gets hard. So we have an innovative truancy program that we started about a year and a half ago, almost 2 years ago, which looks a lot different than when I was an apprentice in the early 90s. If I miss school, I got the old what for conversation. Nobody ever feels good after that chat. And I don't know that if it makes people any better. And we certainly don't believe three strikes and you're out makes anybody
Yeah.
better as well. So now when our learners are no call, no show, our faculty will send a note to Jen's team, and a clinical staff will make a phone call and say, "Hey, John, we noticed you weren't at school today. Are you okay?" And sometimes it's, "Oh, yeah, I forgot," or "Hey, I didn't have childcare," or "Hey, I had to work today." But there have been several instances where that outreach phone call has reached somebody who is at their worst moment.
Mm.
And knowing that we've made that connection, we supported that person in that time of need, and we're able to get them back into a regular scheduled apprenticeship without any penalty just because life got hard. Now they have to repeat semester or miss classes. There's not a free pass here. However, we're also not going to separate you because life got hard.
Yeah. Well, and what you're saying, and I love John, is just connecting it to what you said, Jen, early on, is seeing each person as a person. They're not just a student on the roster, they're a person with a life and struggles and hardships. And so by being really intentional about making that personal connection with someone who is professional, a trained professional, to be able to do that. I mean, you think about, again, it goes back to we all want to be seen and feel heard. We all were hardwired for that. And so you're really just playing on what we all know But to do that, again, I don't know why this is rocket science, but I mean, because it's not rocket science. I don't know why it's not just common practice, and yet it is. So I love that.
Yeah, I think to simplify it, it's just a check-in. It's that simple. It's just a check-in. Are you doing okay? And do you need anything?
Yeah.
And if you don't, that's great. We'll see you when we see you next time.
So how did this program? I'm curious to what pushback did you get any pushback?
No, actually, the only maybe a little bit from my faculty because that added a little bit to their plate.
Uh,
But no, what I hear oftentimes for students, and I'm sure Jen's team hears it too, thanks for checking on me.
Absolutely. And that was a common message was I didn't think anybody knew I was gone.
yeah.
For a handful of those students that were really in need or in crisis, that they thought nobody cared. And it makes such an impact on their lives. And kudos to John because he's done such a great job at changing what that culture looks like in the program that it's commonplace for people to get a call. It's expected that the instructors call. It's the students are accustomed to having us involved if they need something, and the feedback then is great. And the response is outstanding. And I think to what you had said, if people feel seen and heard, and they know that somebody actually cares about them, it's easier for them to show up and actually do a good job.
Definitely.
They perform, they know, even if they have to have some type of, corrective action, have to repeat something, it's not so painful if you know that the intent behind it was just to make sure they had the support they needed.
Right. Right. That support is so incredibly important for all of us.
And these things don't come to fruition if you don't have a partner that you can collaborate with. There's EAP providers out there that you can't have these conversations with. And I mean that respectfully. However, me and Jen can get together and brainstorm and collaborate and always thinking, how can we best serve those that we serve? And what can we do differently? What can we do to improve? And to be able to have a partner like Jen and her team to be able to pick up the phone and brainstorm, and some of our ideas might be a little bit um, far removed from the box. However, we're always looking for better ways to serve our folks, and the truancy piece is just one of them. And we're really proud of, probably the most proud of what we've chosen to do with health assessments of our students, which is simply put, just an extended check-in to see
Mhm.
how a group of students are doing on a regular cadence. And this is something Jen came to us with an idea to better serve our folks. And I'll let her explain a little bit more in
Yeah.
detail.
Tell us more about that, Jen.
Just looking for opportunities again to serve. As we take a look at what we do for the apprentices, instead of just looking at people like a number, which I think which happens a lot in my industry. A lot of resources and check a box and send people out. But with my passion for wanting to actually help people and understand where their needs are without them having to come to us was where this started. So we have people come in and we select a certain population of the apprentices to roll through these health assessment clinics, and we have staff come to the training center, and everybody rolls through a mental health assessment, a substance use disorder assessment, nutritional assessment, daily needs assessment, like a social service assessment, and then a medical assessment. And we look for opportunities across the board in all of those and how we can support the students. And so some of it might look like somebody just going through, answering the questions, having a one-on-one conversation, and worst case scenario, knowing who's in the care team office and knowing that that person's friendly. They're not somebody they have to see because they're getting punished, but they start to develop a relationship with the person who's there. So that's the worst. And the best case scenario, we find people who didn't know they had a service that they needed access to. The amount of homelessness, we see about 8% of the population in the construction trades have issues with housing. And people don't want to talk about it, or food disparities. I mean, it's embarrassing for people to say, I can't feed my family, or we got evicted from our apartment, and we're going to live in our van. Like, we don't know what to do. But if you can bring that to the table in a way where it's a normalized conversation, and then you can get people routed into help in a very confidential way, it just opens the door for how we can help them. So I think, do we just finish our third round of these?
Fourth.
Fourth round of these? And when I look at the numbers for the number of students that came through at the beginning compared to the number of apprentices that came through this time, I mean, the numbers just keep growing. And we've not made it so that it's mandatory. It's volunteer, and the number of people that sign up and show up is extraordinary. And because of that, the utilization of the services in general, those people are coming back. They're talking to their classmates about it. They're utilizing multiple services within the organization, which is great. In hopes, I think our evil plan is we can keep them healthy now,
Yes.
and keep them engaged as they graduate from the apprenticeship program, and then they can continue to come use us, which is amazing.
Yes. Oh my gosh. That is the beauty of the volunteer kind of angle, right? Is because it's such a beautiful organic ripple out of getting people kind of in that circle of getting used to and hearing, because when we hear it from a friend, it's a lot less, I don't know, intimidating than when we're told, what we have to do. So I love that. So, and I think you mentioned that you had just recently got some analytics on that, and they're proving to be very successful.
Absolutely. The number of apprentices that came through the health assessments that are utilizing multiple services is just incredible. And across the board, we just pulled our data for the first 3 quarters of the year, and about 70% of the apprentices have utilized our services for direct visits, not
Wow.
just a call for something real short, but somebody who's actually engaging with one of our professionals, whether it's the social service aspect, mental health, or substance use disorder aspect. And we are able to actually take a look at the reasons why people are coming to see us, in hopes that then, as we continue to look at how John's creating his curriculum for changing the culture, be able to maybe highlight different services where we can provide extra needs and extra care for people. And so it drives a more robust program for the apprentices.
Definitely.
Wow. I love your creativity. And I can tell that you two, you mentioned you've known each other for a long time. Isn't it so fun to have such a great synergy and then to think outside the box of all the possibilities, and to be in positions to be supported to be able to do some of those things.
Drive that change. I think
Yeah.
we have some of the best conversations. The brainstorming is the best part of it.
Ah, I
We
love
think about
it.
all the crazy ideas and all the things, and I think, like John mentioned, if we don't have that partnership or somebody that sits down and you can have a cup of coffee with and say, oh my gosh, like what if we did this? What do you think?
Yes.
And I think the beauty of our organizations is John is a leader that is very innovative and very interested in changing how we look at the apprenticeship program and what that does to the general population. And with our passion for how we serve people, instead of just being a traditional EAP that just is a resource coordinator, but we actually serve those we touch. It's amazing, and I get really excited about it, as you can hear. But that synergy is not found everywhere, and I think as we look at our program, it's getting a lot of attention. Just like John said, I mean, what we are doing is not being done in all the apprenticeship programs, and all of the training centers. And I could only imagine if every apprenticeship program had the ability to do this, or even the desire to do this, and we could touch everybody at this level, it would just grow into an ever-changing culture that would better everybody. And I think for the first time, and you maybe know this stat, but for the first time ever in the construction industry, there's 3 generations of employees.
Oh,
You
really?
have
Okay.
the old school people, you've got the middle-aged people, and you've got the new kids coming out, and they're all 3 very different philosophies on how you treat the next person coming up, how you train people, what's normalized and what's not. And you've got the one group that's the rub the dirt in it, and I was hazed, so you're going to be hazed, and it's just the way we've always done it. And then you've got the young kids who are like, no one's going to treat me like that, and they're really trying to change the culture. And then you've got all the people in the middle going, I don't know what to do. I kind of want to do it this way, but I kind of want to do it that way. And so our hope is that as we're training this new generation to come through, it's going to ever change and ever evolve that culture.
There'll be a new normal.
It'll be the new normal.
There'll be
Absolutely.
Absolutely. Yes, I love that. Jen, I want to just touch on one thing that I remember in our very first conversation that we had a few months ago. And it aligns with kind of what you're talking about with your health screenings. I remember you saying that if a person gets a test result, like let's just say they've got high cholesterol, you don't just leave it at that and give them that information. But that's what normally happens, right? So here's your results. So good luck, and what happens? Well, I mean, most people kind of just whatever, I'm not going to worry about that now. But what do you do differently?
Yeah, it's so multifactorial, right? So if you are somebody who gets that result, you might just listen and throw that information in the trash, put it in your garbage disposal in your brain and away it goes. If you're somebody who actually wants to do something about it and you do not have a provider that has either the capabilities or the knowledge to help you, you'll get a bunch of basic information and you're kind of left on your own. Or you get offered a dietitian and you have to pay for it. So there's a financial barrier there. And our whole philosophy is if you have a result that's not normal, it's our job to help take care of you and serve you. And that is a matter of helping you understand what that test result looks like. How can we get you the help? Do you have a primary care provider? Has anyone ever talked to you about nutrition? I know it's expensive if you have to go. A lot of times it's not covered under health plans, or it has a very expensive copay or deductible affiliated with it. And with our services, that's part of your covered benefit. So why don't you talk to a dietitian? Why don't you work with one of our wellness coaches? And it's not something that's limited. I mean, you can't, for instance, if you're get diagnosed with diabetes, it is not 3 times a year to talk to a dietitian that is going to help you change all those behavioral patterns. It's not going to prevent you from eating tacos. And so you have to be able to work with somebody on a regular enough basis to be able to have that feedback back and forth to help with those behavioral changes. And at the end of the day, the nerd part of my brain always thinks about how much healthcare costs. I mean, we know as a society, as we look at healthcare inflation, we look at our costs of our copays and deductibles and our health insurance and our premiums and all of that stuff. As a society, we've not focused that much on preventive care. If we put the time and money and effort into preventive care and how we take care of ourselves, at the end of the day, our healthcare will cost less. And so there's this whole global aspect of it, and taking good care of people at the beginning and providing them what they need and actually serving them where they're at. I think at the end of the day, organically fixes that problem. I mean, it's going to take a long time, but in my mind, that's the best way for us to progress to a healthier society. Healthcare that costs less money, better access to care and good care. As a provider, it's a struggle to see patients get sent to somebody who doesn't put time and effort into actually taking care of people. And that's one of the things we drive as well, as John knows. I mean, if somebody needs to see a provider, we do everything we can to make sure we vet that provider out to make sure that they're an expert in their field. They're really good at it. You may have somebody that's really great at cholesterol, but maybe really stinks at, I don't know, orthopedic work and primary care. And to be able to drive somebody into the right person is important as well. And we've all been in that exam room where you walk out and you think, well, that was the worst $30 I've ever spent. I don't know.
That was a waste of time.
I don't know anything more now than I did when I walked in, or get frustrated or something like that. And so, but a lot of that is just driven by the way why healthcare is designed. And I feel like we can really break that barrier, even if it's in a defined population, even if at the end of the day, at the end of my career, we helped as many tradespeople that we possibly can to get better healthcare. In my mind, that's a victory, right? You help one generation in hopes that the next one coming behind you can do better.
Absolutely.
And really, just to put a bow on it, just from my own experience working with Jennifer's team for mine and my own family's needs, to have somebody call you to check on you, really feels nice. And I had a circumstance where I was really struggling finding a certain prescription, and a common diabetes medication, but it was very difficult to find. And I leaned on Jen's team for some support, and they helped me. They called, I couldn't even tell you how many, it may be north of 50 different pharmacies to source a prescription that I needed, which that alone was a wonderful, wonderful value to me and my family. However, to get that call the following month to say, hey, were you able to get your prescriptions? Do you need any support this month? Is there something that I could help you with? it don't get much better than that.
No.
And so it's
And
much
people don't
more,
have that kind of time or,
no. And so to have,
energy to do all that vetting and, yes.
and knowing that you just got a group of folks behind you, checking on you, ready and willing to support is needed. And they just don't, and I'm not a unique story. I am the rule. That's just how they operate. And so the follow through is a critical part too. So not only are they helping them with the diagnosis, but the future follow throughs,
Yeah.
I think are really, really important and what separates their work.
Yeah. Well, again, it goes back to you're a person and we care about you.
Mhm.
You're not just a number. Yeah. And I think, Jen, you even talking about, I mean, I feel like those of us in this space have been beating the drum of preventative, proactive for a while now, but I do feel like we're shifting. I think with more of us, and certainly you two in this space of really pushing the limits of highlighting what can happen when we are in that different approach to being preventative as opposed to reactive. It just makes such a world of difference. And the savings we can have and the people's lives that can flourish because of it, it's a win-win. So thank you for being loud voices for that, because I'm hopeful that we're inching our way there. So as we look at our time, I don't want to, I want to make sure that we have enough time for our last two questions. And one is, as always, our listeners and viewers, I always want to leave them with something tangible, something action oriented. So if they're listening and they want to do something, whether it's in their personal life or their organization, I'd love for each of you to kind of share what's one thing that they could begin doing today or tomorrow or this week or next week, to actually take a step in this direction of addressing mental health well-being, in the construction industry or any industry.
That's a good one. I gave this a little bit of thought earlier today, and I had a whole lot of different answers that would fit here. But I thought about what's the simplest thing that somebody could do that takes little to no effort, little to no resources, and that is just to focus on normalizing and destigmatizing conversations. Each and every one of us can do that beginning today. Just making it okay to have a conversation about healthcare. And if we could do that, just that simply alone, paired with our word choices, simple things like we don't say commit suicide, that assigns blame on the individual, and which drives me nuts when I watch my shows and they still say commit in 2025. But our word choices matter. We can all simply not say commit. And also, we shouldn't make jokes around diagnosis. And I hear it a lot around here that the weather's bipolar. Well, is it? Because that's not a fair representation of a person with a bipolar diagnosis. The weather's going to be what it's going to be. If we could just not make light of, make jokes around medical diagnosis, that if we could watch our word choices around suicide, and lastly, just recognize that folks who are struggling, these are diseases of the mind, and these aren't moral failures. And I think if we could just do a couple of those things that require no resources, no
Yeah.
money, it just needs to be intentional and deliberate.
Yeah. Well, it's being mindful, right?
Yes,
Yes, it
absolutely.
is. Excellent. I love that. And thank you for suggesting something that isn't that we actually can each of us do. Being more aware of our words and then sharing our own, yeah, personal experiences starts to normalize that conversation. And that doesn't take any money. You're right. Because I hear that, well, we don't have the money, we don't have the budget, it's things like that. But everything you've shared, is free.
And I think anybody in a leadership role who has a lived experience, please share it.
Absolutely.
Please share it. When I teach our students and I ask a random question such as, who in the room has been affected by somebody with a mental health condition? My hand's the first to go up.
Yeah.
And I think that has to be the case. If leaders can't have the conversations, that can't draw awareness to, can't change their word choices, can't share the lived experiences, the rest of the organization is not going to flourish.
Yeah.
We see that a lot when people get services, especially at high levels, and we take care of people and serve people from every aspect and every group that we take care of, and we hear a lot. I don't want anybody to know that I'm coming, or I don't want, and it doesn't matter if they're coming to get a primary care provider or getting mental health care or substance use disorder care. Nobody wants to talk about it, and you know, I still think that if we talk about what we do on a regular basis and make it normal, I mean, nobody's family is perfect, nobody's life is perfect, and nobody's experience is perfect, but we can all learn from each other. And I think if we really concentrate on how we can take care of other people and serve other people more than we take care of ourselves, it would be amazing what that would do to this world. You know, John talks about kindness. You know, we talk a lot in my organization about we do what's right over what is easy every day. And there's no negotiating around that. Like that is how we serve people. And we expect that level of care. And I think as a group, if we took care of everybody like that, the person you sit next to, you don't know what they came to work with. If they're really crabby, ask them how they're doing. I mean, very simple things about just making sure people are seen and heard. I mean, things that we've already talked about, just
Yeah.
recognizing that. I mean, you may have had a fight with your spouse, or your kid maybe was being a turkey, or something happened that affected you. Maybe just didn't get a good night's sleep, but to have somebody just recognize that you're not okay makes the difference. And I mean, those that know me, who travel with me and stuff, know. I mean, I could go through the drive-through to get a cup of coffee and talk to the person sitting at the counter for a second. I think it makes some people nuts who know me well. My daughter specifically, I'll always say, like, you talk to everybody everywhere you go. But I always think in my mind, just one small act of kindness or gesture
Yeah.
of acknowledgement can make somebody's day. You don't know what they came in
Absolutely.
with, and that can turn somebody's life around by just giving them just an ounce of kindness when you go someplace.
Definitely.
Yeah. And it doesn't take a ton of time. Yeah. So I
No.
think that could be all of our challenges too for today is to reach out to somebody or really see someone and take a moment. But, and again, it takes intention and a little bit of mindfulness to actually just slow down and take a breath and actually see the people in front of you, to see the barista and the cashier and the server and the whoever, right? The colleague. And then to take that next step of just
Absolutely.
saying something, whether it's, a question or a comment. But yeah, love that. Love that. Okay. So as we wrap up our time together, and I really hate to say goodbye because there's just, I know there's more we can talk about and just so appreciate you all being on here. But what is because as our listeners know, I'm always about, we're all a work in progress. And always needing to continue to work on our own mental health and well-being. So what are each of you doing right now to help you manage stress and to stay balanced and to be able to implement all the great things that you're doing?
Hmm.
What's your
It's the
go-to
John.
practice?
It's the Johns in my life that do that. I think as leaders of organizations, and we see this, we talk about this all the time. We deal with a lot, and to be able to have a peer that you can talk to about anything that is happening in your day is amazing.
Yes.
And we see that happen all the time in leaders in our community who you would never know there's an issue, and at the end of the day, there's a bad outcome. And I think that makes such a big difference to be able to find your peeps, to find somebody that you can kind of unload all the day on. I think makes a big difference.
And that can be difficult for some people to find that person. But I
Mhm.
think, again, if we're looking around, I would be honored to be that for someone else. And I think other people feel the same way. So sometimes it's just a perception of, okay, who can I find that I could maybe trust and start building that relationship to become my person? Yeah.
Yeah.
How about you, John?
You know what? Yeah, Jen's definitely my person, and for relationships that start out as an EAP provider, uh, with a service contract with us, has evolved into us checking on each other. We talk every week, whether it's about work, shop, or life. And it's just good to have somebody in that space to lean on. Jen is so smart and supportive in the work that she does. She makes my challenges much more navigable. And I think pairing that with just trying to stay humble,
Mm.
trying to stay humble. And when life is really getting the best of me, giving to others in a meaningful way is the best way to get me out of my funk. And it keeps me humble, it keeps me giving, it keeps me caring, and that goes a long ways.
What does
It
that look like in your life, John? Do you like serve at a soup kitchen? What do you do to give to others?
well, for me, it's the unsheltered population.
Okay.
Um, I was unsheltered once. I felt completely invisible to society. I see unsheltered folks every day, and I don't want them to feel invisible. I don't hesitate to give money, but it's more important to stop and talk to folks.
Your
I have
time.
a habit of stopping and talking to folks on the corner, offering a hug, a kind word, just let them know they're seen.
Yeah.
Because it's much more than a financial contribution, and I'll never have enough money to have a meaningful effect. But like Jen said, just being nice to somebody, being kind, that extra little moment, let people know you see them. I don't think there's anything worse than somebody that has to stand on a corner to panhandle to survive. Um, how degrading and humiliating that must be. And so just to see them and to give them a hug, and that's one of the things.
Yeah.
But
I
just
love that.
generally just try to be kind, decent,
Yeah.
and I'm a hugger, so
Yeah. Well, if you were here, I'd give you a big hug. You look like a good hugger. Well, oh my goodness. Well, thank you both so much, John and Jen, for being here for sharing your wisdom. I want to be mindful of our time, but keep up the good work. And I'm just honored that we have people like you out there who are making such waves in the status quo to change things, and just yeah, grateful for your energy and your passion and the synergy you bring with each other to make a difference. So thank you so much. Really quick, if people want to get a hold of you, how can they reach you?
For Team Wellness Corporation, you can go to our website, which is startwithteam.com. And that will bring you to our main line. It's my same group of people that answer the phones. And our rule is if you don't know where to go, give us a call. And if we can't help you, we will find someone who can.
Awesome. Thank you. How about you, John?
and for us, you can go to our website at www.ftium.edu.
Great. I'm just thinking there might be people who want to visit about various things, and I don't need to be the middleman. They can come straight to you. So, anyway, well, everybody, thank you so much for being here today. As always, we're here to inspire and empower all of our journey of living a life of mindfulness. So, like, comment, subscribe, share. Feel free to contact me at mindful-momentum.com with questions, thoughts, or concerns. And we'll see you next time. Thanks so much.
Thank you.
Thank you.